have to kind of go to the companies, I would say. And the reason I say that is because we don't have any yet peer-reviewed published data on this information, but we have been getting reports straight from these companies that are that have developed these vaccines. So they're reporting, 95% efficacy for the vaccine. And of course, individuals may be hesitant to say, well, what about that 5%? Could I be in that 5%? And a lot of it is due to the fact that there's not a lot that we know about it. We know it's 95% effective. We know that based on some of the preliminary reports, that a very small number of individuals who do get vaccinated actually may end up still getting COVID. And there's a lot that we don't know about the why. And I think that's something that over time, as we administer more widespread the vaccine and learn more about, the different types of people who maybe can or cannot take the vaccine, because some individuals are just won't have the immune support to receive the vaccine. But I think for the majority of individuals, it probably will be safe and effective. That's a good question. And I will say that it's very subjective because the reasons that individuals avoid or maybe hesitant toward a vaccine are so varied. So for those individuals who maybe their reasoning is, well, I want to know more, I have a fear of the side effects or of the unknown regarding the vaccine, probably with time, as they see more individuals receiving the vaccine, we know more about the science behind it, we get some published results from these vaccine trials, I think some individuals will certainly be more receptive toward receiving a vaccine. But similar to what we've seen with, MMR vaccine, which has had many scientific studies that have examined the efficacy of it, that have examined that misinformation about the link between autism, what we see there is despite time and despite the findings, there's still a group of people that are still opposed to that particular vaccine. So there's always going to be some individuals who, as time goes by and as we learn more about it, there's still going to be some individuals that are hesitant. And those are the individuals that we kind of have to see, well, what is their reasoning behind it? Well, so there's kind of a twofold question here. It's how long will it take for most Americans to be vaccinated? But also, you may have heard, well, what is the kind of the number of individuals that need to be vaccinated in order for it to be effective? So as far as, when most Americans can expect to receive the vaccine, as far as like publicly, I would say that will probably be some time. And the reason being is that, all the states have kind of a state by state mandate for how they're rolling out the vaccine. They all have their different phases of who gets the vaccine first, who's next in line, et cetera, et cetera. And this is something that differs state by state. And we also have to keep in mind the limited number of, vaccines that we're able to retrieve at one particular point in time. So I think it will probably be well into the next year before the majority of Americans can, be vaccinated, because the first thing we have to do, we have to take care of our frontline workers, and we also have to take care of individuals who are at severe risk for COVID-19. And so as we see these vaccines become more and more administered publicly, we will start to see, that transition. But I think it will certainly take well into the next year